Hello, my name is Leah. I'm going to do a head-to-toe assessment on you. Is that okay with you?
Yes.
Okay. So first, just a general inspection. You don't appear to be in any distress. You don't have any labored breathing, no accessory muscle use, nasal flarings. You have good hygiene, nutrition. And then can you tell me your name?
My name is Doug Nygaard.
And can you say your date of birth?
March 15th, 1958.
And do you know where we are right now?
Yes, my house.
Good. You see your alert and oriented times 3. So first of all, I'm just going to do the head and the neck. So your head is symmetrical. I don't see any like masses, lesions. I'm just going to feel for your thyroid. Or your, yeah. Can you swallow? Good. I'm just going to feel it. Okay, feels good. Good. It doesn't feel enlarged, swollen, or anything like that. Can you swallow again for me? Okay. And your trachea is midline, so that's good. And then I'm just gonna feel your lymph nodes. Sorry, my hands are cold. The preauricular, postauricular, submental, submandibular. And then you have your cervical, the anterior, posterior, and your occipital, and then supraclavicular. Good. Those were good. And then I'm just gonna listen for a bruit. I'll be using the bell of my stethoscope. Okay. So if I can have you turn and then take a deep breath and hold it. Okay, good. Just gonna do the other side. If you can turn to the other side and take a deep breath and hold it. Okay, we're good. All right, I didn't hear any bruits. So the next thing I'm gonna do, I'm gonna look at your eyes here. Check for perla. Okay. So just look forward for me. Okay. Your pupils are round, and I'm just do it one more time. Just look forward. Good. And then if you can follow my finger. Good. So your pupils are round. They're reactive to light and accommodation. And then just look forward for me one more time. Sorry, I think you're kind of close. Okay. And then, I'm not hitting your eye. Okay, good. I saw your optic disc, the red reflex. Just gonna switch over to this. Now I'm just gonna look in your ears. Okay. Okay. Just gonna look in the other one. And you don't feel like any tenderness
No.
when I touch it? Okay.
Mm-mm.
You don't feel any tenderness over here, do
No.
ya? No? That's good. So, look good. I don't see any lesions, masses, discharge. Your tympanic membrane was like a whitish gray. Then I'm just gonna look in your nose here. Sorry. Okay. Good. Your turbinates were enlarged. I didn't see any drainage. Your nose is nice and symmetrical. And then I'm just gonna feel your pulses. I mean, not your sinuses. You don't feel any tenderness when I do that, do you?
No.
No? Good. And can you open your mouth? Okay. Say ah. Okay. So your lips, they're nice and pink, moist. Your tonsils are about a 2 plus. Your soft palate rises. Your teeth not showing any decay. Uvula is midline. That's really good. Okay. And now I'm just going to test your cranial nerves.
Okay.
So the first cranial nerve would be testing for smell. So can you smell this?
Yes.
Yes. Okay, good. And then for the second cranial nerve would be testing your vision on the Snellen chart, but we don't have that, so we're just going to say that's what we would do.
Okay.
For cranial nerve 3, 4, and 6, if I can just have you follow my finger. To the side. And we're going to do diagonal. And then, okay, that's good. And then for cranial nerve number 5, I'm just going to test your facial sensation. Can you feel me touching you?
Yes.
Okay. And then cranial nerve number 7. Can you smile for me? And then frown. And then like puff your cheeks out. Okay. Relax. Okay, that's good. And then for cranial nerve number 8. No, okay. We're just gonna test your hearing. If I can have you cover one ear, that one probably. I'm gonna whisper a word and then you're gonna say it back to me. Okay, yes. Now can you cover the other ear?
Right.
Okay, that's good. So that was cranial nerve, let's see. For cranial nerve 9 and 10, can you swallow for me? Good job. And then for cranial nerve number 11, if you can push your shoulders up against my resistance. Okay. And then can you push your face against my hand this way and then the other way? Okay, good. And then for cranial nerve number 12, can you stick out your tongue and move it side to side? Okay, that's good. That's all your cranial nerves. They were as to be expected. Now I'm just gonna find a skin lesion somewhere, like a mole or something. I see one on your head here.
Okay.
So just the A, B, C, D, E's of this. It's symmetrical, the nice clear borders. The color is red, and the diameter it's about half of a centimeter. And it hasn't like evolved or changed, has it?
No.
No. Okay, that's good. Okay. Okay, just gonna kind of feel for any crepitus here. Good, I didn't feel any crepitus. I don't feel any masses, lesions on your chest. First thing I'm gonna do is I'm just gonna listen to your breath sounds. I'm gonna switch it to the diaphragm. Okay. I'm gonna do 6 on the front, 6 on the back, and 2 on the side. Can you take a deep breath for me? And let it out. One more. Good job. Yep, just keep taking that breath. can you lift this arm for me? I'm just gonna take another deep breath. Okay, good. You can relax that arm. And then lift this arm. Take another deep breath. Okay, good. And then, just gonna listen to your breaths on the back. Take a deep breath for me. Okay, we have 2 more. Okay. All right, that was good. All your breath sounds were clear. Now I'm just gonna listen to your heart with the diaphragm and the bell.
Okay.
So let's see here. So first we have aortic, and then pulmonic, and then herbs, and then tricuspid, and then mitral. Okay, I'm just gonna listen to them one more time. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, that's good. All right, done with that. Can you sit forward just for just a little bit? I'm gonna check for CVA tenderness. Let me know if you feel any tenderness. No?
No.
Okay, I'm gonna do the other side here.
No.
No tenderness? Okay. And next I'm just gonna do an abdominal assessment. If I can have you lay down over here. Okay. Do you mind lifting it? For sure. Okay. Okay, so first, an inspection, your skin color is appropriate for your ethnicity. I don't see any lesions, scarring, anything like that. So first thing I'm gonna do, I'm gonna listen to your bowel sounds. Just switching it to the diaphragm. Okay, good. Your bowel sounds were good and nice and active. Now I'm just gonna listen for bruits. I'm gonna switch it over to the bell. Okay. So the aortic, and then iliac, and then renal. Okay, good. That was good. I didn't hear any bruits. Now I'm just gonna palpate. You let me know if you feel any tenderness. Sorry, my hand. No tenderness?
No.
I'm just gonna do a little bit deeper. Still no tenderness?
No.
Okay. Now I'm just gonna check for liver and spleen enlargement. So I'm just gonna find your rib cage. Can you take a deep breath? Okay, good. Okay, that's good. I didn't feel any liver or spleen enlargement. You can go ahead and sit up again. Thank you. Got it?
Yep.
Okay.
So that can-
Yeah, you can have a seat again. We're gonna go back. I just realized I forgot to check your pulses. So I'm just gonna check all of your pulses here. First we're gonna do and then okay. And then just I need to get behind your knees. Okay, those were good. I would give all your pulses like a 2, which would be normal.
Okay.
So next thing we're gonna do just for your extremities, we're just gonna do like an inspection. Your skin color is appropriate for your ethnicity. I don't see any lesions, swelling. Just gonna check for edema. You don't have any edema, so that would be a grade 0. I don't see any varicose veins. Just gonna test your strengths. Can you squeeze my fingers hard as you can? Good, good. And then put your hands up, and then push up against me. Push up, push down, good. And then can you push out, and then push in? Okay, good. And then for your legs, if you can lift your leg up against me, and then lift this one up. Okay, and then push your legs out against, and then back in. Okay, that's good. And then I'm gonna check your reflex. I'm gonna check your reflexes. So first one we're gonna do, just relax your arm. I know it's hard, but you gotta relax as much as you can, okay? Oh, there you go. Now, the next one, just relax. Try to relax it as much as you can, okay? That was good. Oh yeah, there we go. I saw it down there. Then this is the last one. We're going to do the brachioradialis. So just relax your hand into my arm as much as you can. Good. I saw the movement in your hand a little bit. Now, if you can just let your legs rest. Try to relax them as much as you can. Oh, there, I saw it move a little bit there. Just do the other one. There you go, that's good. And then one more on your foot. So So I'm gonna hold it up, and the point is your foot is supposed to go down against my hand. We're just trying to get your foot to go down. Okay, I saw it move a little bit there. And then the other one. Just trying to get the top of your foot to move down. Oh, there it goes. Okay. Good job. Yep. Those are all good. And then next, just going over making sure we didn't miss anything. I'm just gonna look at your gait. So if I can have you stand up, and if you can walk, like walk that way, walk regular, and then on the way back, walk like heels to toes.
Okay.
So you just okay, that's good. You can do mine. Okay, you're good. Good. You have a nice, strong, steady gait. You don't appear to be a fall risk.
22 minutes.
Okay. And then we're going to do one more test. It's called the Romberg test. So you're just going to stand there with your arms down at your sides and close your eyes. Okay, good. You were nice and steady. That's good. That's to be expected. Okay, thank you so much for letting me do this assessment on you.
Thank you.
Yep.